Okay everyone, it's Dr. Aaron Van Gaver coming to you from downtown Vancouver, talking about smoking cessation. So a lot of individuals struggle with smoking tobacco. I certainly smoked when I was a university student. Thankfully for me, it wasn't a difficult thing for me to get rid of. However, I'm dealing with a lot of patients that struggle with a smoking problem. There's a bunch of different ways that you can deal with this. Here in BC, we've actually got quitnow.ca, which is a website that anyone from British Columbia can access, and the government will actually cover 12 weeks of nicotine patches or gum for you once a year. You can also call 1-800-QUIT-NOW and you can access the same program. But if you're not interested in trying one of those things like the patches or the gum, you can try pharmacotherapy. We have Zyban and Champix that are the two main medications that are used to help individuals quit smoking. The research shows anywhere between a 16 to 25% benefit when using pharmacotherapy to help someone quit smoking. Did you know it takes an average of 9 attempts to actually quit smoking? That's pretty hard, eh? Well, I actually work on a really great protocol. It's called the Bastyr protocol. It's based on taking a look at your smoking habit and breaking it down to all the different addictions or the different behavioral addictions associated with that. So that is drinking a coffee and having a cigarette, waking up in the morning having a cigarette, having food, having a cigarette, having sex, having a cigarette. And so the idea, this Bastyr protocol works at slowly breaking down these habits week by week. And so it all starts out with getting a small little notebook and a little pencil like a cigarette and recording every single one of your cigarettes that you have. So if you come to see me, you would sit down on day one, we would pick a day of freedom, a day that you were going to quit about 4 to 5 or 6 weeks down into the future. And from that initial point that you meet me, you're recording all your cigarettes that you have over those next 4 to 6 weeks. In addition, you're doing supplements like N-acetylcysteine, which works really well at reducing cravings and helps supporting the liver as well as your lungs. And then if you do need some nicotine replacement therapy, we can actually get the herbal form of tobacco, which is lobelia, and you can put this in a tincture, put these into drops in your mouth or into a thing of water, or you can actually make yourself a lobelia tea, which actually can help with the cravings. So the cool thing about this program, guys, is you're very conscious about it. You're recording every one of your cigarettes. You're taking vitamins and herbs that are going to help to quell the cravings. And then every week you get a new list of instructions of things that you need to do. And so to give you an idea, the first week is you're actually only smoking using lighter or matches with 1 ashtray. You're not smoking within 15 minutes of waking up or going to bed or eating or drinking or having sex. You're switching the hand in which you're actually smoking from. You're actually switching the fingers between where you're holding your cigarette. So if you're normally holding it between your second and third finger, we're asking you to switch to your left hand, smoking between your third and fourth finger. And so the idea is every week you come in and I give you different instructions for different things to do. And at the end of the 4 or 5 or 6 weeks, your smoking habit looks nothing like it did that initial day. So if you're struggling with a smoking addiction or smoking habit, guys, reach out to me. I'm really happy to help you out. draaronvangaver.com, or you can give the clinic a call, 604-629-1120. Thanks, everyone. Talk to you soon.